Good afternoon, everybody. Sorry about that. Welcome to this new episode of BHHSeries. My name is Aline, and I'm the Chief International Officer of Barcelona Health Hub. So BHHSeries are monthly events that we have been organizing from Barcelona Health Hub since March last year around topics related to digital health. And we've been doing that with and for our members and other experts and guests from around the world. So today we're back for a second episode organized in collaboration with Braun. So last time, if you remember, we talked about value-based healthcare and what can be done to maximize the value for the hospitals and the professionals and the impact on patient outcome and the healthcare systems. So today, the discussion will be more centered around patients and the communication and support between healthcare professionals and patients before and after surgery. So for that, I've got the great pleasure to be accompanied with by experts from the field, from Spain and from Germany. So first we have Naira Marin, she's the Senior Channel Manager at Braun. Elke Ries, Director Channel Management, Orthopedic and Spine Surgery at Braun. Professor Eckhard Meyer, Chief Physician Orthopedics at Allgemeines Krankenhaus Celle. Dr. Jaime Sampson, Senior Surgeon at University Mutua de Terrassa. Dr. Isiar Lazaraña, also surgeon at Mutua de Terrassa. Dr. Salvador Llopis, also surgeon at Mutua de Terrassa. Y Max Sales, Director of Strategy and Processes at Essential. Welcome, everybody. It's a pleasure to have you here tonight. So I will ask each of you to introduce yourself like 1 minute each, briefly, so the audience know more who you are. Mark, would you like to start?
Yeah, of course, I can start. Well, in my case, I'm an industrial engineer, but I'm specialized in the surgical process, and now at Essentia, I'm the Director of Operations. 2 years ago, I was the Deputy Director of Processes and Innovation at Braun Hospital in Barcelona. And that's all.
Perfect. Elke, would you like to introduce yourself?
My pleasure. Thank you, Aline. As you said, I'm working in the channel management as director for orthopedic and spinal surgery in the international sales area of Braun Esculap. I started my career in product management, learned a lot while being head of a knee implant on a global basis. This was a very teachful time, an interesting time. Now, as I said, I'm working in international sales. My background is international economy.
Perfect. Professor Meyer, please introduce yourself.
Thank you, Aline. Hello, everybody. My name is Eckhard Meyer. I am originally from Munich, Germany, and after school I went to Innsbruck, Austria. As I am an Austrian, I studied there and I worked there for 11 years at the medical university. I'm an orthopedic surgeon, and in 2012 I moved to Germany back, and now I'm here in Celle near Hanover. You don't have to know it. From my surgical background, I started with computer-assisted surgery and robotics. Then I concentrated on minimal invasive surgeries, especially the direct entry approach to the hip joint. I was heavily promoting, and in the last years, I was concentrating on processes surrounding the discharge and the patient itself, like a fast-track concept like ERAS, and we will hear today further on. So that's for the second.
Fantastic, thank you. Dr. Sampson?
Yes, hi everyone, I'm Jaime Sampson, I'm a surgeon at Mutua Terrassa. We are a team, we are together now, and we dedicated to abdominal wall surgery and also minimal invasive surgery, as well as endocrine surgery, and we are in charge of the pilot study with the app for now.
Okay.
I am Isiar Lazaraña. I'm a general surgeon of this hospital also. This hospital is a medium-sized hospital. We have 500 beds, and we are we have this project in this hospital, and that's all.
And I'm Lopez, which I'm a junior surgeon, which I'm helping with Dr. Samson and Dr. Larrañaga with the app and the surgeries that we are doing.
Fantastic. Well, thank you so much, everybody, for being here tonight. And for those, Naira, sorry, would you like to introduce yourself? You're muted. You're muted.
Now, sorry for that. Thank you, Aline, for the handover. So, good afternoon to everyone. It's a pleasure to be here today with all of you. I'm Naira Marin. I'm Senior Channel Management, also from the global team in Braun, and also responsible for the global business services and new digital solutions. We are working from the Center of Excellence. So it is a pleasure to have this roundtable and also collaborating in order to organize together with the Barcelona Health Hub. Thanks to all the organization also for that. And thank you to all the participants to be possible to be here today to discuss about this interesting topic about hospitals, healthcare professionals, patient empowerment, and all of that. So looking forward for a great discussion. Thank you very much. A pleasure.
Fantastic. Thank you so much. Well, so you mentioned, especially the doctors, the app, ForPatientApp. So Naira, can you tell us a bit more about the app?
Yeah, actually, it's more than an app. Actually, it's a hospital platform, right? We call it that it's a patient engagement platform and an app, and also an application for patients. Actually, the aim of this digital solution is to provide a channel communication and also in order to connect both hospitals, healthcare professionals, and patients within this solution before and after their surgery. So the idea is to connect and to provide this digital companion along all the surgical process for patients and professionals during all the pathway. But I invite you to see a nice video where you will get also, and you will see a better overview and a nice overview of what it's all about and how it looks like.
Welcome to ForPatientApp. I'm your digital doctor. I'll be by your side from now until the day of your operation. I'll be your guide, and I'll explain everything that's necessary before and after your operation through your mobile phone or tablet. We want to offer you the most important information provided by the best doctors and specialists. From here on in, we're in this together. Listening to me will help you to follow the guidelines and advice that our clinical team will explain to you in your consultation. Together, we'll make sure you're absolutely ready for your operation and that afterwards you'll recover and return to your routine. On the platform, you'll see videos and text that will help you to understand the different phases of your surgery, with the aim being to answer the most common concerns. You'll also have a diary where you can make a note of important dates like consultations or the operation itself. Finally, every now and then the platform will ask you a series of questions that will help healthcare professionals to find out more details. Before I say goodbye, I'd like you to answer the following questions, which are required to personalize your platform. Let's start.
Very nice. Nara, can you tell us how that platform was born? How ForPatientApp was born? You muted?
Okay, I will leave it open now. Yes, of course. Actually, that was some of the coming from the process of moving. I think that from not only from our side, many companies we are moving from products to services, right? Because we wanted from Braun to offer something else besides the product, right, or besides a medical device. So what else is needed out there? From the hospital perspective, from the healthcare professionals perspective, and also from the patient focus, no. So from the industry, we also can offer solutions on that terms, providing something that together with our products offering, we can also bring value and a real impact, no, to change a little bit the rules of the things that we have been doing till now. and how the things are changing, because healthcare is changing. No, we all of us, we know that, and we need to adapt it to that through the digitalization and through the new solutions, no, to work with from all of us, from all our sides. So that was more or less part of the history behind to do something else, and also on bringing those new solutions. No, but I will hand over actually to Elke, because I'm pretty sure that she can also complement that part.
Thank you, Naida. Actually, yes, is what you said. Also, Professor Maya already said prior. Yeah, was the reason why we entered in that project together. We started 2013 to look a little beyond the product and to look at the patient pathway, following the ERA's protocols and the ERA's, let me say, attitude. Yeah, it's more than just protocols. And then you learn that a lot of parameters play an important role for the success of a surgery, of a treatment. And a big part is really the preparation of the patient, and as we call it, the activation of the patient. As best as the patient is involved in the own treatment, yeah, the better is the result. So in the traditional way, to be honest, you go to a hospital and somebody tells you have to be on a certain place at a certain date. Maybe you get a certain flyer, but that's it as a pre-information. Yeah, and then you maybe as a patient you have a lot of anxieties, and you may be so nervous when the surgeons and doctors are explaining to you the details of the surgery that you forget part of it, and you have a lot of questions after. So these are elements that are not so favorable. And it's really proven, and we have a lot of evidence about that it is good to educate and to involve the patient. So in 2013, we developed a complete program, patient pathway program, along the ERAS and beyond ERAS concepts. And it was just a consequent act that we then joined our colleagues from Barcelona. And together we said, let's dive into this patient engagement platform and develop a good solution.
Fantastic. So now I would like to ask a question to Professor and the doctors. So now you're currently doing that pilot with ForPatientApp, and how were you communicating with your patients before, and what did you like about the app, the platform, that made you decide to start a pilot? Professor, would you like to start?
Yeah, sure. So my incentive to start and why I got interested was very curious, was funny, I would say, because I have a hairstylist, and if I want to make an appointment, I can do it online. And the funny thing is, I got an email reminder the day before my appointment, and I thought this is a good thing to do, because I usually forget my appointments. You know, during the course of day, you're not concentrated on different things, and I thought this is actually exactly what I want to have. A digital communicating platform to the patient, and surrounding all of these appointments with total hip arthroplasty, for example. It's very important that you stay to all these appointments, and these reminders would be good. So I was curious about this platform, and now I communicate to the patients exactly this way. I ask them, are you interested in having something on a digital way? And to be sure, I would say 90% really like it, the idea. Oh, yes, it's good, give it to me. So I will try it at least. So patients like the idea of having something on a digital platform, because everybody has got a cell phone right now in the hands, with the exception of the super old patients, but even they tell me, my son or my daughter or my nephew, they are good with computers, they will help me. So acceptance
Fantastic.
is good.
Doctors, would you like to share your experience? Like, how were you communicating before with the patients, and what did you like about ForPatientApp?
Yes, that's a good question. And it's true that due to the high amount of patients we have to visit in the office, the time you can invest on each patient is scarce. Approximately 10 to 15 minutes for every patient. So to explain all the procedure, the disease, and all the patient will have to go through, it's very difficult to do it. So we saw in the application a way to expand this communication and give the patient and the information, a great amount of information, and also information of quality, because the app was developed by healthcare professionals. So that's why we were interested into into the app.
Fantastic. Thank you so much. Mark, I've got a question for you. So can you tell us a bit more about the surgical processes challenges when it comes to patient empowerment?
Yeah, of course. Toti, can you put my slide, please? Well, like Naira said, and the professors and doctors, well, first of all, patient empowerment begins to achieve good results in their recovery. And this has a lot to do with the hospital processes. Yeah. When we think in value-based healthcare, the first thing we should think about is not about results or cost, but about how we increase the quality of our processes. And we can only work on this if we are clear about patient safety, improving the clinical practice, and the agility and efficiency of the processes. If these processes are worked well, the health results arrive, and consequently, costs are reduced. And so, first, increase the quality and efficiency of our processes to achieve good results. In terms of increasing value in the surgical process, our experience has shown us that there are different phases to focus on, as well as different levels of work. The first challenge is the cultural change necessary to focus on a transformation phase of such magnitude. Here we show you some of the projects that within their level or phase of the process increase the efficiency of the surgical process and provide us with an increase in real value for the patient and for the service professionals. If we want to increase the empowerment of our patients, we must bring them to correct tools that, in this case, could be a platform or IPP for monitoring their preparation to the surgery. This is the ERAS, or in this case, the multimodal rehabilitation, and it's a cross-cutting project because it impacts all phases of the surgical process. In the second slide, Toti, please. This diagram shows the scale of stress suffered by the patient who is told that he will need surgery. The level of stress is very high in the initial stages, of course, during the waiting time, and especially the day before and the day of the intervention. On operated on, the stress scale decreased greatly. Yeah. This fact is relevant to ensure that the patient arrives well prepared for surgery. And the first step is to reduce their levels of stress and anxiety, which make it difficult for patients' health to perform physical, nutritional, or mental exercises to arrive to the operating room in the best conditions. Well, and in the last slide, Toti, in this case, well, this would be a common process in a surgical hospital of multimodal rehabilitation for surgery. Generally, these rehabilitation programs are only available for very specific types of procedures with a volume of annual patients acceptable to a team of nurses, physiotherapists, psychologists, and nutritionists. In general, this program is very intensive in human resources, which make it difficult to scale to the program to all surgical patients. As seen in the process, rehabilitation has actions that must be performed throughout the surgical process, especially in the pre-surgical stage, but also on the day of surgery, recovery, hospitalization, and post-surgical follow-up. If when we talk about empowering the patient for surgery, we mean that the patient must take part in the process and take co-responsibility, not just act as a privileged spectator. Yeah? We must prepare the patient for the process. He must understand what will be done to him, and that he must have an active participation. This means that the patient must be well informed, like Professor says, through reliable sources. He must know his rights, but also his duties as a patient, so that both surgery and post-surgical recovery are a success and involve the least time possible. And this will be lead to better health outcomes. Yeah. At last, well, the process has a high impact on health outcomes, but this must start from the day the patient is aware that he or she will need to undergo surgery and begin the preparation process. This involves a major effort in the pre-surgical stage in order to control the levels of anxiety, stress, and as well as pain if they need. Yeah. In this sense, we believe that the best process for the success of surgery and its recovery is multimodal rehabilitation, which has pre-, inter, and post-surgical procedures that ensure that the patient arrives in the best conditions. You will need less invasive techniques for surgery, and your recovery will be more satisfactory and faster. Therefore, the great challenge of the surgical process is that multimodal rehabilitation programs reach any type of surgical patient, not only oncological or more severe ones, but also procedures of moderate complexity or outpatient surgery. And well, at last, we encourage all hospitals and providers to promote programs and systems that incorporate these rehabilitation programs. Yeah.
Thank you very much, Mark.
Thanks.
So now I'd like to come back to the professor and the doctors. So you've been piloting the ForPatientApp for a few months now. So can you tell us a bit more about your user experience? So you as healthcare professionals, and also what value does it bring to you as healthcare professionals? Doctors, do you want to start?
Okay, the number of users we do have right now is still quite limited, so probably it's still early to take conclusions, but we have seen so far is that the patients accept this new communication channel very well. It's clear that the acceptance of the APP will differ among different profiles of patients, but with the widespread use of mobile application for different aspects of daily life, Mark makes us confident that we'll have a high level of acceptance and a good feedback from patients.
Yeah. If I may, we began with this pilot study in February. After a few meetings with Naira and her team, we started. So we divided in three phases. We set a timetable. So the first 3 months is for the recruiting and just finish this phase. So we are starting to operate in this patient, and we want to measure the acceptance rates and also how the patient interacted with the application. So far the acceptance rate is quite well, and that's what we can say about it. And for us, the value is to we believe that information is the key. As mentioned before, a well-informed patient is probably less anxiety, less pain, and everything goes better. Thank you.
Perfect. Professor, would you like to share your experience and the value for you as a healthcare professional?
So yes, it's difficult to say because the German healthcare system doesn't foresee the patient return to me after surgery. So they are treated outside in the following follow-ups. So they have no direct communication. But we were looking into the data, how much time they spent in the application and what were they most searching for or Googling actually. So interestingly, the number one was the video. So I've implemented a video where I was talking about the fast track concept and stuff like this. And this is the things they like the most. And the second most topic that they clicked on was the team. So, and this is exactly my experience. I've got a patient school, and for the patient, it is very important to learn the team and what it's all about. So the information that's important for them, I can provide now digital, I would say. And I've got the idea that I put a lot more videos into the application, because this is something we all like, obviously. So if I remember my daughter, she always has their handy or their cell phone in their hand, and she's always YouTube videos or Instagram and stuff like this. So, and for me, the most best important thing is to bring more videos for more information. And the other thing is, with the patient school, I give talks and refer to the patient and what they will expect and why I want them to stand up early and stuff like this. And after 2.5 years, giving the same talk for 2.5 years, it's kind of get boring, I would say. It's always nice, but it would be better if I have all the information digital and they have to see it beforehand. And that's absolutely true. We have to be careful with the little time we have with our patient, especially in Corona times. What we have seen is we had limited access to the patient, or we have tried to limit it, and so our contact time was very low. And with the application, this is one method of getting my information. I want to have them on a digital way, and this works good because after the surgery, I visit them on the ward, and they don't have too many questions because they have already seen the video. I know you from the video, and I was standing up like you said I should do. So this is very helpful, especially in these pandemic times.
I would like to mention. Sorry, I would like to just to also to in order to follow what you are saying, Professor and doctors. And actually, this is from our side. We also realize so there are two high topics here. One is how crucial is to have quality information. As many times with you doctors, we have said one of the problems that we have from our patients. You were saying that they go to Google and they Google everything, and this is not quality information, right? And you also say that, Professor Meyer. So one of the things that we see that it's really valuable, in that sense, is that it's a really high quality information because it's information that comes from healthcare professional experts and societies and so on. And the other thing, what you were mentioning, the way of how we communicate has changed. So today everyone is more in Instagram than maybe in another kind of platform. So all the videos and everything. So this is changing in a really high speed, right? And actually this kind of a solution, this platform that allows to introduce these new ways of communication like video. So when we started to develop the content of ForPatientApp, we already thought videos actually it's going to be one of the things that we expect the patients, the users will like the most. But it's confirmed, right? And I think that really it's because we are in this evolving communication process, and it goes along with what is happening in our environment, right? So completely agree on that.
Exactly. Elke, where do you see the value for patients and hospitals to accompany the patients before and after a surgery?
Look, what we learned when we do the consultation project in the hospitals, is that the nurses say, well, the patients always ask the same questions, right? And they like to spend a lot of time with the patients without any doubt. But often they are in a hurry, stressed because there's not enough personnel. And this is one part where I see a good prepared patient, will not have always the same questions that you normally, of course, have, So when will I be able to go to the toilet again after surgery, Will it be possible that I can take a shower? So all these very clear and important things for the patient are answered, So I think for the personnel for the healthcare professionals, it's really Very nice. The other benefit I see is what also Mark explained very nicely, the good onboarding of the patient. It's somehow standardized. Yeah. So you have, once you make a big work, you think about what is important content, and everybody is getting the same content. Huh? Otherwise, in the, how is it called in English? When you get the patient and you do the education of the patient, the consultation, is that the consultation part? I think. You have different surgeons doing it, yeah, and everybody is telling as best as he can the most important things that he believes are the most important, but it's a variety inside. It's not the same, yeah. So I think it's good to have it standardized. It's good to have something where at home the patients can have a look. It's good to get familiar with the doctor. I think the videos, brilliant idea to see the doctor explains, the nurse explains, and the physio shows again the exercises or whatever that can be done. This makes you familiar with the people that you then see in the hospital. Yeah. So this is where I see a really huge benefit.
Fantastic. Mark, can you tell us how an app like ForPatientApp or a platform like ForPatientApp fits into the patient journey?
Yeah, of course. Well, I think that to adapt the patient journeys to better preparation for surgery, we need to ask ourselves this question: what worries the patient? What is the patient's concern? When a patient is undergoing surgery, the experience anxiety and stress, and most likely pain as well. The more complex the surgery, the higher the anxiety level. Yeah, this is where we need to focus during the pre-surgical process. Each phase of the patient journey has its stages, of course, but it's clear that the main one is the preparation before arriving at the operating room. For this reason, rehabilitation seeks to focus on patient preparation, both physically and mentally. Rehabilitation programs incorporate a comprehensive view of the patient from a medical and emotional point of view, covering the needs of pain reduction, knowledge of the procedure and its treatments, the adequacy of the diet and emotional preparation. This is the reason why the team is made up not only of the doctor or nurse who follows at all times, but also of a team of psychologists, nutritionists, physio, who prepare the patient to arrive at the surgery in the best possible conditions. Yeah.
On that sense, Mark, I have a question for you. No, how do you think that, because we are talking and you're mentioning, no, how important is to work on this rehabilitation approach, no, as we were discussing also Elke was mentioning, no. How do you think the hospitals would accept, or how quick the hospitals would accept to work more on this approach, if for example this kind of solutions, no, allows it, no, because as far as we know, so the kind of multimodal or rehabilitation approach is something that it's taking more importance. It's in the good direction, but still it's in a minor 10%, no, of how this is implemented within the different specialties, no, in hospitals. Correct me if I'm wrong, Mark, but
No, you're right, of course. Always.
we understand it still is in a minor position, no? So how, from your expertise and from your knowledge on all of that, what do you think, how this could speed up or help hospitals not to implement this approach in a better way through the digitalization and these kind of solutions?
Well, it's true that we need that now. It's a big need for the hospitals. Yeah, they can arrive to all the patients that they have in the hospital. During last years, no, they always put these programs only in a few procedures. No, sometimes only for the oncologists or when the surgery team wants to improve this kind of projects, but not like a strategic approach of all the hospital. Yeah, we are sure that in a few future in the next years, all hospitals want to introduce the surgery patients in this kind of programs, because it's a necessity, and it's true that it gives us or bring us a good results. A good results that at last they can convert in economic impact for the hospital. Yeah, and another part is that you have to standardize and democratize these kind of programs. Not not every surgery team goes for their own way. No, you need a unique way, a unique strategy for the hospital, and when you put a platform, you are standardizing the process, and this is very important for the hospital, of course.
What do you think, doctors and professor, about that? Now, from your side.
Yeah, that's true. That's true. Especially in Germany, we're way behind in the digitization process of the hospitals, and the German government is highly interested in pushing these things up. So there's a lot of engagement in this, and a lot of money pulled out now, and the hospitals are supported now to increase the digitization. And for example, for my hospital, I've been told that we are searching for something, a digital solution, an application in this. And it was funny because I was already testing. So they didn't know, because I don't wait for them, because they always sleep and are way behind. So with Braun, I was much quicker, and I'm already in the testing procedure. And but this is actually the way we are all going to. We have to. So I think it's inevitable. We have seen in the pandemic, we are moving now to something like this. We all sit somewhere in the worldwide and we discuss together. So digitalization is helping, and the same is true on the patient side. And actually, it was absolutely right. And this is, you can prove with data that the better the information to the patient, the better the outcome. I can absolutely support that. For me, it was a no-brainer that this is the direction we have to go. There's no way around that. So we're not now 80 any longer, but we are 2021 now. So it's time to go onto those pathways now.
It was easy to convince you, Professor Meyer, once you saw it. That was nice. Yeah.
With navigation. I like computers.
It started with navigation, exactly. What I think is also an important point, and I would have a question to the Spanish team of doctors. We have in some countries, and this is also nice with the app, more and more, let me call it the motivation, not to use the word obligation, to document the outcomes, like the proms and the prems, with scores. And so often this is still done with paper, and then the patient is not responding, and then you need to call. It's a hard work. So how is that in Spain? Is it already part of the documentation you need to make to have a score follow-up of the satisfaction of the patient?
I mean, it's not all obligatory to know how the satisfaction of the patient, but it's some kind inherent with the process. We want the people to be satisfied, but and that's another how to say advantage of the app. For one, on one hand, the patient gets some information, but also we can get the feedback, and we can use it to do some investigation as well. We can say form, we can ask whatever we want. For example, the pain scale for the hernia, and we are going to do it in a later phase. So that's about it.
It's an interesting advantage. I think it's very nice.
Yeah. In that case, I think that also is interesting, no? Because we have today in our in this roundtable, right? Different kind of experiences from you both sides, no, Professor and Dr. Tarrasa, because you, Professor Meyer, are coming from the experience, no, of using this in the orthopedic, of course, field. But then hospital Mutua Terrassa is actually working or having experience in hernia patients. This actually, I think that this is also it's the good thing of having different perspectives, no? Because actually the kind of the patient it's different. I think that what we were actually talking about, which kind of recommendations or which kind of let's say this multimodal approach, no, could also differentiate, depends on the case or depends on the indication, actually, no. Maybe in general surgery with Dr. Larrañaga and with you, Dr. Samson, we have been talking many times, no, that not only in hernia surgery, but when we thought also in oncology patients, then there is more complexity behind, and therefore more need to also to activate, right, different kind of activities and follow-ups and the potential of working on all of this holistic approach to the patient, no, brings even more power, no, to that. So I think that also it's a factor, not to put on the table of discussion the kind of the patient that we have in front of us, the kind of pathology which is behind, and therefore the kind of actions or activity that we could expect, no.
So as you have already mentioned, then this is true. This is more of a platform than just specific for one case. So my thinking was that it's not only about elective surgery in orthopedics, but also in trauma surgery. I've got a colleague and we do a lot of trauma, and don't do them immediately, but we send them home and then they return 3 to 4 days later, and then we do the fractures and something like this. And some indication is possible. So I think if you want to have a good high standardization and you have something elective, then this is actually the way you can use that. It's not only orthopedics, at least in my impression. So I would use them for just the radius fractures and stuff like this. So you can adapt this to whatever you want. As I've learned, I can send you anything and implement it in your app. It's easy for you.
I would also like to ask, no, because I have seen it in some cases, like in me, no, in just in some days that I was around there with you, doctors, in Mutua Terrassa, but what about also the not only the patient, no, from the patient perspective, also from the family's perspective, no, because, well, you, Professor, you were also mentioning that based on the age of the patient, sometimes we think that these digital solutions are not for the patients, but actually they are open, no, in some cases, because then you have the son or the daughter or the family member next to them that they will use for them, no. So how is your experience, doctors and professor, on that?
That was one of our questions. No? We are going to implement some app, but most of the population is old. I mean, it's probably older than 70. So, but the thing is that there was a surprise, a nice surprise, because of what you just said. It was with the family and the old patient, and they accepted the app. So and one of the daughter of the patient said, "Give me the app. I will explain him how to use it." So
That's nice.
it's easy because also the people is accepting the app. When the people that don't goes with didn't accept the app, it's not that accept, but they didn't have the smartphone or the application. So probably this is a field to improve. If we ask the elderly patient to comes to the visit with the family, probably we will have a high rate of people with the app.
Yeah, good learning. Yes, definitely.
But interestingly, it's not only about age. The funny thing is, I've got a 90-year-old patient who liked the idea very much, and today I've got a patient 50 years old who doesn't have doesn't use a cell phone. So this is funny. So this is about the open-mindedness towards this new techniques, I would say. But Corona helped a lot. We are doing home office now. Everybody knows that. We are doing online shopping, and we're doing our communication via online. So why not using this? This helped a lot. You could immediately feel that. But it's not only so that the elder ones doesn't want to use it. They are already interested. So the acceptance is quite high in every age, I would say.
Yes, definitely. Corona has changed all from one day to the next day, actually, right?
Yeah.
Yes.
If you don't mind, I'd like to address some questions from the audience. We have a few questions. So how do you measure the effect of broader education on reducing stress and anxiety? I would like to take that question.
Yeah, that's a good question, actually. It's not this hard to measure, actually, especially when we started with the ERAS concept, where we suddenly had a patient school, we talked to the patient, and we had a lot of forms they had to fill out. We started to check before we started with the fast track concept, and we proved everything afterwards, after we have started, and you could see a tremendous improvement in satisfaction and secureness, in the relaxation of the patient, and outcome, and reduced hospital stay, and many factors. So it was highly successful, and the key factor to the success was definitely the information we provided to the patient. So the better the information is, and the more direct you have these patients, then they can accept it, and they feel and know what you want from them. They feel secure. And this was nice to see in our forms. We could see and check with these questionnaires. It was SF36, it's called. And we could see tremendous improvements, nearly perfect results now. So this was very satisfactory. You can see that immediately, right from the start.
Perfect.
You used also another score, right? Sorry, Aline. I mean, you used the SF36 and you used the German score called PPP. But there is also another score out there. It's called the DAS score. Yeah, maybe for the audience interested. Yeah. So for those who want to measure it, it can also help.
Yeah.
So we quit actually now giving these questionnaires because there's no room for improvement now. So this is just now complaining about the quality of the food and something like this, or something I don't have in control, I would say. But the general tendency was raising high immediately. And this stayed true now since we have this concept. And the better the information, I have this patient folder we created for this project, and I want to get rid of this folder actually and to have it only digital, if possible. Now I can show you this one here. You can see it. It's called My New Joint. It's a patient folder where we have integrated all the information, and this is all the information we can put now on the app. So my next plan is to quit the folder and just to give the app. I forced them to use it actually. Let's see if it works. I don't know.
Very good thing. Very good thing.
So we have another question, like related a bit on the same topic. So Virginia is asking us, can you elaborate on the activation of the patient? Is it mainly related to this information pre-surgery to reduce stress, anxiety, or is it something else? How much influence does this stress have in the actual surgery results? And is this mainly in complex live-death surgery or in all of them?
So I can answer that. It's on both ways. First, it's knowing the team because they see me several times during the appointment. I do the talks, and then in the patient school we also do a physical training. My physiotherapists are coming, and we train together. We show them how to use these crutches, so how to walk stairs, how to do a 4-point walk and stuff like this. And they have to train before the surgery, and afterwards we force them. I tell them, I want you to stand up on day of surgery. 3 hours after surgery, hip or knee, it doesn't matter. You have to stand up, and people believe you, and they do that actually. Something which was unimaginable before we started. Usually patients stayed in bed for 1 day, and then the blood pressure was very low, and I had a very long hospital stay. I could get used to the half. So after 4 or 5 days, patients say, I'm bored, I've got everything, I'm walking stairs, I go home now, bye. So that's really on many levels. And the more they see of the team, the more secure they are. And I think actually that it doesn't matter if the information is provided during a live talk or a video from us. I think this will result in equal measurements, I would say. Of course, the training with the crutches we will do physically here in preparation, but all the other stuff, I think the information can be done by myself. I'm talking to them into the camera of the phone, I would say. Like here now, you believe me what I'm telling you? Or do you?
We do.
Yes.
We do.
We do.
Doctors, would you like to add something?
We think that to have the confidence, to be confident with the patient and to have the opportunity to talk directly to them and to interact with them is very important in all the surgical process. So the patient is have less anxiety and comes to the hospital more prepared, and they know which steps they will have to go through, and they have a good experience, even though they have a disease.
The idea, I mean, we are in the pilot study. I mean, and we are just have data of the acceptance rate. So we need to know how they interact with the app, and we have to wait for that. But we believe that the result will be as good as the acceptance rate. And we wanted to start with the hernia procedure because it was a simple procedure. It was something we can do it a little bit not fast, but easier. But I think the app it's made for also complex procedures, and
Yes.
you can apply the result for the hernia to the complex one. It's a win-win.
Perfect. Elke, Naira, Mark, do you want to add something?
Sorry, Professor, you first.
Oh, I wanted to just refer what Mark was saying about anxiety of the patient, and this is absolutely true. So the better the information and the more they know the team, the less anxiety you have. You can feel it during surgery. There's much less muscle tension, at least in the orthopedic surgery. They have much less pain afterwards. So the usage or the need for painkillers or in high doses has decreased dramatically, as well with the knee. Before it was impossible to flex to 90 degrees on the next day. Now it's regular. It's the common thing to do, and I haven't changed my operating procedure, I would say, but all the surroundings of that, and this created this huge impact on better mobilization and less pain. So I've got a pain pump, so PCA pump for the patient. 90% don't use them after a knee surgery, which is extremely painful usually. So this was interesting to observe. I think we changed the mind of the patient. Yeah, if they don't have this much anxiety, now they're coming, I have to stand up, and they want me to flex the knee. So now they're relaxed. Oh, it's okay. They told me, I know about that, and I do it. It's interesting.
If they know it in advance, they are okay, no? Yes.
No, it's fantastic. Now I love knees now.
No, I wanted just to confirm that yes, of course, as we were saying at the beginning, no. So this is a solution that allows different kind of realities and situations to follow and to follow the patient and to provide information to the patient, to provide the right information and in the right moment, no. And maybe we have started already with those indications, but of course it's ready to go with more complex cases, as the doctors were saying. Where actually even now we see the benefits, or we can also think about the impact already, not only for the patient but in general to better clinical outcomes, as the professor was mentioning. So if this is happening in those cases that are not that complex, so in the cases that are more complex, even we can expect a higher impact. No? So yes, to confirm that it's actually the track to follow.
So we have now just a few minutes left, and as a conclusion, I'd like to ask each of you, starting with the doctors and the professor, if there's some hospitals, some surgeons, some colleagues watching us today, what would you tell them? Why should they use such an app? Professor, shall we start with you? Brief conclusion.
Yeah, sure. So I think it's more not about the patient, but it's about changing the mind of the surgeon as well. So what I have learned during this fast track concept is changes. So we have to change our view to several things. When you start, you are trained, and you think you will do that till the end of your life. And I think life has changed, and I think we have to adapt to the new techniques, to new technologies, I would say. And if you're open-minded, you can change to something, and it's absolutely an improvement, not only for you or your team, but also for the patient. So I would always recommend to stay on top of the wave of digitalization.
Fantastic. Doctors, your conclusion?
I think that in recent times, operating rooms have experienced an impressive technology advances. However, the patient is still being a passive subject. So we think the patients have to be at the center of all the surgical procedure. So this APP permit this. So for us, it's very important. I think we have to change minds and to give the power to the patient. The patients have to think about to have to be informed of everything.
Fantastic. Elke?
For me, this is just a logic evolution. Yeah, so we all are taking our phone for everything. Honestly, yeah. So without our phone, we would not have any navigation, any access to information, calls, communication. Yeah. So I mean, this is the one device we are using, and I think we can be brave and just believe that our patients also are able to use these devices, even the elderly ones. Okay, maybe we are now having 40% or 50% who might be reluctant, but very fast, yeah, in the next 2 or 3, 4, 5 years, this will change. I'm very, very sure. And I like your folder, Professor Maya, but I think it's much easier to have it all on the phone and to have more interaction. And one last comment I like to make. I know that neither in Spain or in Germany, when we had our preparation workshops, neither the doctors want to have exchange with the patients, because there was also this legal part, etc. If you go to India and to other countries, I mean, they have WhatsApp groups and they send all over pictures, yeah, and the communication is direct and easy. I think we may not be in a status, and we don't want to be in a let me say, non-data protection surrounding, yeah, like in India. But these kind of devices, it's a natural evolution, yeah. It's what we need to be all well aligned. Yeah.
Yes.
Mark, your conclusion?
Well, very quick. My conclusion is at last this is a healthcare quality. Of course, the privatization achieves a reduction in patient stress and complications. Is a scalability. When considering telematic follow-up, you can do it in all surgeries, and it's a cost reduction. No, and well, it's the new digital services for the relation with patients. And it's also important to remember the role that plays the nursing team, because they are a part of this process, and sometimes we don't remember that they are playing an important role in this privatization model. And well, I encourage of hospitals, of course, to do this.
Naira, last word for you.
Thank you, Aline. From my side, of course, agree on all the comments summarizing this. But from my side, I would share an additional comment in terms of wider to have like a wide vision of all of that. No? So in conclusion, I would say it is important to have this wide vision on that solution. And as Mark now was saying, this holistic view, holistic approach, where actually everyone is important to be there, everyone is involved on providing the right information into this channel, no? That could be this new way of communication between patients, hospitals, and professionals. No, this is just a start, but looking forward, of course, to push it forward. Yeah.
Fantastic. Well, thank you everybody for being here today. Thank you, Professor. Thank you, doctors. Thank you, Elke. Thank you, Mark. Thank you, Naira, for being here today, for sharing your knowledge and for inspiring others to do the same. And thanks everybody for being here tonight and watching us. So what's next for Barcelona Health Hub? So we will be present at 4 years from now, in a few weeks from now. So we'll have a booth. So please come and see us there. We also have 9 sessions, speaking sessions in total on different topics around patient empowerment, about hospitals, about investment. So if you check the web, barcelonahealthhub.com, you can see the program over there. And then we'll announce it also at 4 years from now, but just in premise for you today, we will have an investment forum event in September, the 28th of September. It will be focused on artificial intelligence this year, and the applications will open on the day of 4 years from now, the 28th of June. So you can also come and see us there. We can give you more information. And so BHHSeries, we're having a break now for the summer, and we'll be back in the fall for a new edition. So more information to follow on the website. So thanks everybody, and talk to you soon. Bye-bye.
Bye-bye.